This is Dr. Bethrand Odume. I will be presenting on bi-directional screening using CAD4 TB. I'm the Executive Director of KNCV Nigeria. KNCV Nigeria, we're a national NGO. Presently, we are being funded by USAID, supporting active case finding, both facility and community-based across 14 states in Nigeria. I will use this opportunity to share our experience in a pilot. This is just an early experience in integrated COVID and TB testing that happened in the wake of the COVID pandemic in Nigeria. That's between June and July 2020. Next slide. Yeah, from introduction background, I will be able to share our experience, the intervention, share the results and the lessons learned, and I will conclude. The next slide, please. COVID and TB, though different biological agents, but they have very many similarities. The transmission is by close contact. Infected patients show respiratory symptoms as the primary organ of infestation is the lungs. Social distancing, stigma, and discrimination have become very great key issues, and need for early testing and care to improve on mobility and decrease the mortality associated with both diseases, and the risk of exposure actually very high among healthcare workers, both for TB and COVID. And equally nice to mention that the same diagnostic tool had come in this integrated intervention, looking at GeneSpart technology. Next slide. Now, look at some background. What are the likely reasons? We've noted low COVID cases in Africa. We know this can actually be ascribed to weak laboratory infrastructure, low testing capacity, even lack of testing kits, weak health, strong infrastructure, unpreparedness for the response, and even perceived low risk, which has been ascribed to some other theories. And noting also that the gold standard had been the reverse transcripted PCR, which was actually key to diagnosis in Nigeria before the approval of Express SARS-CoV. This actually very expensive, issues around power supply, non-functional lab network, ineffective sputum transportation system, and paucity of trained personnel. This actually hampered the optimal use of PCR. But it's nice to say that in March 2020, with the approval of point of care diagnostic test for COVID, the Express SARS-CoV, this actually opened up the space. Since in Nigeria by then we had over 400 GeneSpart platform across the country. And I want to know that by June, looking at what had been done, even by the introduction of GeneSpart, over 127,000 tests were done, 39,539 confirmed COVID cases, with about 845 recorded deaths from COVID. The next slide. Now, what we actually implemented in Kaduna and Imo, two of the states where we work in Nigeria, is an integrated approach to COVID and TB testing in the peak of the pandemic. The National Center for Disease Control and Prevention, the Nigerian NCDC, adopted the Express SARS-CoV to complement the existing PCR capacity in country. But the good news then at that adoption, we had over about 400 GeneSpart machines across 48% of the 794 local governments in Nigeria. And sincerely speaking, looking at those GeneSpart sites then, there were suboptimal utilization of these machines due to other optimization challenges ranging from power and human capacity and the modular failures. But the coming of COVID, we expanded the scope, and GeneSpart was approved for testing, and more resources were actually deployed to ensure optimization of those GeneSpart sites. The next slide. Now, the key intervention, the picture there is actually when we deployed. KNCV presently have the 2 mobile van, all equipped with mobile digital X-ray with the GeneXpert machine, 8 modular. We have one in the upper part of the country, the northern side, and another one in the southern part. The strategy we adopted is to professionalize integrated testing using the mobile diagnostic van, which we call in Nigeria the wellness on wheel, the wild truck. It provides one-stop access to digital chest X-ray, because in each of these trucks are fitted computer-aided detection for TB, the digital X-ray with 8 modular GeneXperts each. And the intervention we did in Nigeria is actually the earliest testing recorded for integrated testing of both COVID and TB. And this was actually carried for about 1 month period, starting from 11 June to 16th of July in 2 states of Kaduna and Imo states, covered by the 2 wild truck, the northern and the southern truck. And I will be able to share the results from this experience. The next slide. Now, the key to our intervention actually is a multi-stakeholders approach. We worked with the USAID, who is our funder for the TB loan project, because we actually leverage on the USAID resources that provided for the loan intervention across the state we work. We probably worked with Nigerian Center for Disease Control, the WHO, the National TB and Leprosy Control Program, and the state team in the Kaduna, who you can see in the picture is the governor of the state, Malam Nasir El-Rufai, which provided substantial support that made this early intervention possible. The Kaduna states were actually very, very supportive in that they actually provided the very first express SARS-CoV in country that actually made the operationalization of the community intervention very possible, and we were able to ride on that to scale up across other states in the country. The next slide. Now, prior to implementation, I was actually very key that KNCV team, our laboratory team, we worked under the Presidential Task Force for COVID to work with other stakeholders, the Institute of Human Virology, the National TB Program, and then CDC, to actually adapt the tools and define the implementation guidance, all which tools were developed, guidance documents were developed, and even the SOPs. This actually formed the basis and the tools needed for training of the laboratory workforce across all the states, not only the states we work, but across other states in country, because that opportunity offered the training of the lab following the approval of NCDC for the use of GeneXpert for COVID detection, and equally the availability of the express SARS-CoV in country, the cartridges needed for testing of COVID. We actually provided the personal protective equipment needed for multi-stakeholders, and these were deployed to other GeneXperts, and equally made provisions in the 2 wild truck that have been deployed for the integrated testing. These were actually followed by advocacy. Many states were reaching out to KNCV for support, but the pilot actually started first in Imo and Kaduna states, and the experience is what we'll be using this opportunity to share. You involved key stakeholders engagement, both the partners working in the states at the national body after the development of the tools and deployment for training. And as I said earlier, we received a very, very great support from the state government that made the community intervention very successful. The next slide. Now, as I said earlier, the very first thing, these are very new tools that were developed for the integrated intervention, because TB is just a program and COVID came on board, but I've told you about the key similarities and the very unifying factor in the integration of the 2 diseases, looking at GeneXpert technology, which was deployed for both TB testing, had been deployed for TB testing and found useful in COVID testing. We worked at the laboratory subgroup to develop these key tools. This is the referral form for COVID testing, and the other side is the result form, and in between is an integrated register that you could actually see cascade of all the events from both TB diagnosis, gene expert diagnosis for COVID, and even other disease entities like HIV. And every patient registered can be captured longitudinally in the register. These tool actually made the integrated response very, very possible. Can you go to the next slide? Now, these are actually the tools I mentioned earlier, the request form and the result form, very concise and developed by the team. And this actually made the intervention across the states, across all the expert sites that were designated for the testing of COVID very, very possible. The next slide. Now, looking at this algorithm, this is actually the SOP developed for the integrated intervention. Was actually very key. Once those localities were identified, this followed by advocacy, working with the state government team and the local government. And the initial meeting of the gatekeepers, mobilizations were done before the deployment of the wild truck. You could see that in the SOP adopted, who is actually a very high risk, most hard to reach localities that lack access to healthcare services. And looking at the very first is the registration, all which in the intervention we did in the 2 states within the 1 month period, 1,931 clients actually registered. And looking at the SOPs, every registered client actually had to pass through the CAD4 TB screening. And immediately after the CAD4, our cutoff in country actually was 60, score of 60. And everybody that passed through the CAD4 screening actually have the opportunity of passing through a tent where the nasopharyngeal swab were collected for COVID testing. And you could see that more patients actually submitted for CAD4 screening, and very few, about 679, that may have declined for COVID testing. I've talked about the issues around stigma, which was actually very heightened during that period of lockdown and isolation and healthcare facility admission. Now, for everybody that submitted on nasopharyngeal swab, this shows the number of presumptive among those submitted for COVID testing. That's about 80 and 80, making it 83. And those that didn't submit, about 3 of them met our presumptive score. And for every presumptive, they actually submit in a tent there for a gene expert diagnosis. And I said earlier, those 2 vans have 8 modular gene expert. And right there on the spot, diagnoses were made. And since we are already working with the team of the community healthcare workers providing services at resource centers, immediate linkage to care were equally done. And working with the state team, those that tested positive were equally linked to the COVID task force within the state for admission, those that merit admission in the selected admission centers during that pandemic. Can you go to the next? Yeah, was actually very key looking at the results. This actually provided an avenue for integrated services. You could see, in as much as we were able to find about 183 cases of COVID, 11 cases of TB were found across the communities. The intervention was done in the 2 states. And you could see equally when some in the state, especially in Kaduna, they provided rapid test kits for HIV screening. 11 clients actually came out as positive, and equally the screening was actually an integrated intervention. They provided equal test kits by the state government for hepatitis B virus screening, and out of 665 that were tested, about 7, both male and female, came out as positive. And we equally looked at the co-infection, both TB, COVID-19, HIV, and COVID and hepatitis. Next slide. Now, what are actually the key lessons? As I said earlier, community integrated platform, which we offered, actually provided access to early diagnosis and linkage to care. You will be worthy to note over 183 COVID cases, 11 TB cases, 7 cases of hepatitis B, and 12 cases of HIV were actually detected. We had to leverage on the resources because the war truck was there with the team. There are multiple tents, and it was nice to mention that some incentive were actually provided in some of the states to encourage people to come out for testing. Community engagement, as it was very, very key in meeting the gatekeepers, advocacy even before deployment at the community levels, followed by awareness creation. It really helped to mobilize and it will address issues around stigma. Effective coordination and collaboration among all stakeholders in the states will work very closely with the state governments, both at the state level and the local government level, and other partners supporting both COVID and TB intervention in states were equally very key to the success. And the COVID-19 screen and test actually routine, other medical tests were actually integrated. I made mention of hepatitis B screening that equally provided for the community, the clients that actually came out for the screening. And this integrated approach helped in reducing the associated stigma, where they know that this is actually a combined package, not only that being called out for COVID screening, we will provide screening for TB, provide screening for hepatitis B, as the case may be. The next slide. Now, in conclusion, for efficient use of resources, I'll say about our mobile diagnostic van with CAD 4, it should actually targeted and complemented to other community and healthcare facilities. Because when you are deploying these resources, it will be nice to leverage on that opportunity and the structures we have on ground to integrate other healthcare services for the community. And the focus for intervention actually should be to the hard to reach communities, vulnerable populations. We looked at people living in slums, people that are internally displaced, and some other IDP camps within the location. It really targeted the very, very hard to reach locations and the people that lack access to services. And this actually made a whole lot of contributions and informed lessons we learned in that initial intervention that informed other scale-up of intervention across other areas that we worked during that pandemic. I will use the opportunity, the last slide. Yeah, to actually acknowledge all the stakeholders that were key in the success of that initial pilot. The publication there is actually where we're able to show the early experience in implementing the integrated testing in the African Journal of Respiratory Medicine. And we must equally recognize the National TB and Leprosy Control Program, the KNCV TB Foundation Netherlands, the Kaduna State Government, the NCDC, USAID, our funder, and the WHO, who were equally very key in that intervention in those two states. And the last, thank you from all of us at KNCV TB Foundation Nigeria.